Bronchiolitis Pediatrics Introduction. Bronchiolitis is an infection of the airways of the lungs. It mostly affects babies and young children. Bronchiolitis starts with symptoms similar to those of the flu and cold. Then it turns into wheezing and coughing. In most cases, the child's body fights the infection and the symptoms go away. There are things you can do to help your child be more comfortable. In some cases, the symptoms of bronchiolitis could become more severe, requiring that you see a doctor. Recognizing these symptoms is important so your child can get immediate care. This health education tutorial is for parents of young children. It will give you tips for preventing bronchiolitis in your child, as well as explain what causes it, what the symptoms are, how to treat it, and when to call the doctor. The lungs. Bronchiolitis is an infection of the lungs. This section reviews the anatomy of the lungs to make it easier to understand bronchiolitis. The lungs allow us to fill our blood with oxygen. The oxygen we breathe is absorbed into our blood in the lungs. When we breathe in, the air goes through our mouth and our nose. From there it goes to the pharynx and then through the throat, which is also called the larynx. It then goes into the windpipe or trachea. From the windpipe, the air we breathe goes into a bunch of little tubes called bronchial tubes. These are located on each side of the lungs. The smallest tubes are called bronchioles. At the end of the bronchioles are small balloon-like sacs called alveoli. The walls of the alveoli are very thin. Around the outside of the alveoli are small blood vessels. Oxygen that we breathe in goes through the very thin wall of the alveoli and into the bloodstream. CO2 goes out the other way through the thin alveoli wall from our blood to our lungs to be breathed out. All along the insides of our bronchial tubes we have a special substance called mucus. The mucus helps trap dirt from the air we breathe. The mucus comes out when we cough. Very small brushes called cilia protect the respiratory tract. The cilia constantly push the mucus out of the lungs. Most of the time it is pushed out automatically. If there is too much mucus, we cough it out. Causes. The air we breathe has germs in it. Our immune system protects our lungs from infection by fighting most germs, like viruses and bacteria. Sometimes, though, germs are able to get past the immune system and down into our lungs. When that happens, it can cause inflammation in the lungs. Inflammation is the immune system's normal response to contaminants or injury. The inflammation of the bronchioles is called bronchiolitis. When a child has bronchiolitis, the bronchioles can fill with pus, mucus, and other fluids. In adults and older children, the bronchioles are wide because they've had time to grow. In babies and younger children, the bronchioles haven't had time to grow, so they are still pretty narrow. That's why babies and young children have more problems breathing when their airway is blocked by pus, mucus, and other fluids. A lot of times in babies and children, bronchiolitis is caused by a virus. Antibiotics do not fight viruses well. For that reason, doctors usually cannot prescribe antibiotics to fight bronchiolitis. Viruses that cause bronchiolitis move in the air we breathe and the things we touch, just like the viruses of the flu and cold. We can get them from each other. It takes a certain amount of time, usually days, for a virus to cause an infection if the body doesn't fight it off. Bronchiolitis is contagious, which means it spreads from person to person. Preventing bronchiolitis is always better than treating it. You can prevent your child from getting viral infections by washing your hands and avoiding other children who have flu-like symptoms or bronchiolitis. Children who are breastfed receive immune system protection from their mothers. That is why breastfeeding decreases the chances of getting bronchiolitis. Symptoms.